Okay, so we have Mr. White. He's a 17-year-old male. He came in with um, a vertebrae fracture and a complete spinal cord injury on his T7. He was snowboarding about 3 weeks ago. Um, and he had it fixed with screws and rods, and he's been doing fine. And he was to be discharged home. But when the CNA wasn't giving a bath, he didn't have a bowel movement or any incontinence when urinating. But when we went to check his blood pressure, it was 189 over 100, and his heart rate went to 56. So then I went into the room immediately, and I checked his bladder distension, his blood pressure again, and they were all the same. So the autonomic dysreflexia was something that we obviously responded to pretty quickly. Um, his temperature was 103.6. He was warm. His abdomen was soft. It wasn't distended or anything like that. But when we went to talk to him about how he was feeling, he was very anxious. So I go ahead and just had him turn to his side, sit up to the semi-Fowler's position, and I noted that there was a washcloth underneath of his back, so that was causing his sympathetic nervous system to engage. So we went ahead and gave him some nitroglycerin, zero point 0.4 milligrams sublingual. And I checked back in 5 minutes. His blood pressure went down to 142 over 90. His heart rate was still at 70. And he was still having some anxiety, but it was decreasing. And his temperature went down to 100.6. So I just gave him some time to relax after administering that, and then he was good to go. And I did educate the STNA on kind of how to prevent that, and I also had some education with his medication and how to prevent any of this from happening again, or some signs and symptoms to let me know.